Well, welcome to the show.
Thank you so much for having me. I'm really psyched.
Can you introduce yourself for my listeners, please?
Sure. So I was thinking about this on the way here, and I was like, how do I want to do this? I'm Maddy Ellberger. I am a DBT and CBT therapist in New York City. I'm an adjunct professor at Columbia, but I'm also just like a regular gal. Like I'm just a regular old New York City 34-year-old single who happens to do DBT.
Did you grow up in New York?
I was in Battery Park till I was 7, then in Jersey till I was 18, and then college back here for grad school, the whole 9. So I've been here for most of my life.
Yeah. You're an East Coast gal.
Yeah.
How did you get involved in this line of work? I always find it very fascinating what brings people to becoming a therapist.
Sure. So there's 2 different sort of pathways. There's that Maddy becoming a therapist and Maddy becoming a DBT therapist. So I went into undergrad thinking I was going to be an attorney because I was an overachiever as a kid. I had gotten a 5 on the AP, so I didn't have to take Psych 100. So I was like, great. I'm going to just take a psych class because I can, because I already have the credits. And I was just like, oh, I'm really good at this. This makes so much sense to me. And so it was just automatically, let's say my first semester, and I was like, okay, I'm going to do therapy of some sort. Fast forward, I finished undergrad, went to grad school, finished grad school, started working at a private practice that was psychodynamically oriented because I was like, I wanted to diversify my experience. I was super cognitively behaviorally trained at Columbia. So I was like, I want to do something different. And so I was at this practice, and absolutely no shade. It just really wasn't for me. There's plenty of really good psychodynamic treatment. It's just for me, seeing people not have the tools to make change was really difficult for me.
Mm-hmm.
And so I was like, okay, this isn't for me. I learned something and I need to go back to my roots. And so I had a friend who was like, there's a DBT practice hiring. I had 0 DBT experience, lots of CBT experience. And I interviewed and I got the job, and I feel like DBT, I am so well suited for DBT. DBT, I think it's a self-selecting treatment. It's not for everyone, but the clinicians who buy into it are so huge and important, and so I'm a DBT person through and through.
What would you say the main differences as a therapist who does DBT who started in different modalities?
Sure. So there's a couple of different, I think, intervention level things. I would say in DBT, it's a big B, little c treatment, right? So it is a cognitive behaviorally based treatment. Marsha's first book is called Cognitive Behavioral Therapy for Borderline Personality Disorder. And most CBT is cognitive heavy. So, checking thoughts and, arguing with thoughts. And that works for a lot of people. It's just that if you're a person with really big emotions, you tend to have more rigid thinking. I certainly relate to that. And so DBT really focus on behavior change because the emotions and the thoughts will follow. And it's just theoretically easier to change behavior than it is to change thoughts, especially if they tend to be more black and white. Mm-hmm. So I would say the fact that it's big B, little c really differentiates it from other cognitive behavioral treatments. And I would say as a therapist, and this is something that if you haven't figured it out yet, you'll figure it out, DBT allows you to really be a real person, and I don't know if that was your experience with your therapist. I would imagine 100%. It is. Yeah, my patients know a lot about me. My patients knew when I was going through a divorce. My patients knew when I had a boyfriend. I was going through a big breakup. I know about my patients' lives. I go so hard for my patients because it's a real relationship.
Love that. No, It's so true. I know my therapist's children's names, and I know what colleges they go to, and I know these very intimate details that makes me feel like it's a real relationship and I can trust her.
Totally.
And I go into there not feeling paranoid or oh yeah, what does she think of me? She thinks I'm crazy, la la la.
Yeah.
I feel like I have a genuine attachment to her as well.
Yeah, I mean it's the same thing for I love my patients. It's a job. There are times I wake up and I'm like, I cannot do this today, and I love my patients and I go so hard for them, and that's why my patients are able to do the really hard work. I'm just there kind of pushing, but if my patients didn't trust me and feel like I was a real person, why in God's name should they do anything that I suggest, especially for people who are coming from DBT for lots of different reasons. And so that to me is the core difference. Lots of psychotherapies are well, you don't really disclose. We disclose all the time. We disclose all the time, and it's for the sake of the relationship and for the sake of the treatment.
It's a two-part relationship.
Exactly. It's like really, really two-way street, and it's, I think, like the most beautiful thing and unique.
What is, for someone who's never heard of DBT, like what does it stand for? What is a dialect?
Okay. So it's Dialectical Behavioral Therapy. And kind of in a nutshell, the way I like to think about DBT, like totally layman's terms, is it's a treatment that helps people with really big emotions, or really kind of anyone, but people with really big emotions figure out a way to accept, identify, and manage their emotions so that they are in control rather than the emotions driving the car. The person has choice and capacity to do what they want or don't want with their emotions. And so that's DBT in a nutshell. How do we do that? We have several different parts to treatment. The most kind of like DBT-ish part is the skills training group. So skills are great because they give you, like, to me, it's like the blueprint. Like, it's like you need to learn these things, which probably most of us already know. We learn them with a new level of intentionality or mindfulness. And then when you're in individual therapy, you're figuring out, like, you're taking the things that come up in your life, the patterns, the thoughts, the interpersonal stuff, and you're saying, okay, I'm trying to learn this new blueprint. Like, how do I apply this blueprint to, like, my current landscape so that I can do things differently, so that I can feel like I have the capacity and the tools to move my life in the direction that I want to move it in, which is the best thing ever, I think. And a dialectic is the, like, philosophical thing that there can be at least two truths at the exact same time. So I can say, I love Eileen, I think she's fabulous, and at the same time, I was really, really angry at her. It's not I love Eileen or I hate Eileen when she does something wrong. It's I love Eileen and she did something that wasn't cool with me, so I have to figure out what to do with that. It's just not so black and white. So it allows us to have a flexibility in our behavior and our thoughts and our emotions that for most people, regardless of where you stand on the emotion spectrum, is really, really difficult, I think.
Totally. I think it's an empowering type of therapy.
Absolutely.
It, like, teaches you how to take agency over your life and your behaviors instead of just thinking about it.
Yeah. Thinking isn't doing. This is like a classic Maddyism. I say this all the time. Thinking isn't doing, and you can't think yourself out of feeling something or doing something. It just doesn't really work that way.
Yeah.
You need to have a replacement behavior.
What kind of people is DBT best for, or what kind of issues do patients come to you with?
Okay. So traditionally, DBT is utilized for patients with borderline personality disorder. Borderline personality disorder has a horrendous reputation in the psychiatric community. It's actually, like, really tragic. And so Marsha Linehan has saved so many lives by creating a treatment that helps both patients and therapists figure out how to make borderline personality disorder, which is just extreme emotion dysregulation that comes out in impulsive behaviors and interpersonal difficulties. It's not the craziest thing in the world, but like it creates the opportunity for people who experience that way of being and living and having those emotions to have, like, it not be like a terminal illness. And so that's number one. That's DBT was created for borderline personality disorder. I like to say the treatment of big emotions. Okay. That being said, it is now used to treat, I mean, like, there's been research for, depression, OCD, substance use, eating disorders, particularly binge eating and bulimia. I like to think, and this is kind of like what I say to patients when they call me or when they come to treatment, it's really about what's getting in the way and what you need to do to change. So I think that DBT could be for somebody who is maybe not on a level 10 of emotions, or doesn't have a personality disorder, or doesn't have really, really deep depression or anxiety, and yet still needs skills. So maybe they're not doing fully adherent DBT, but you bet your ass I'm giving them skills in session. Otherwise, like, it wouldn't be reasonable or fair.
I feel like a big component of it is teaching you even to label what's going on with you.
Absolutely.
Like labeling your emotions.
Yep.
Do you find that you have patients who come to you who don't even know what's going on with them?
Absolutely. Right. I mean, invalidation, the whole biosocial theory, I'm sure you've, like, learned it at some point, but this idea that, like, when, like we operate in a world, like particularly Western culture, American culture, is like sit still and be quiet, except for like if you're on Bravo TV, you know what I mean?
Then
like,
you can throw a glass.
Literally, like then you can like literally do whatever you want, or like you're in The Sopranos. But like other than that, like it's like stay in your box, you know, like stay in your lane. And so if you're a person who's born with, there are like actual neurological markers for intense emotions. I won't like do the boring science thing, but like they're there. And so if you're a person who has this internal actual neurological biological experience, you're going to receive messages from everybody who loves you and everybody who has the most utmost care for you to tone it down in one way or another. And it's usually not direct. It's usually like, it's going to be fine. Don't worry about it. Or if you just do X, Y, and Z, or you don't worry, I'll take care of that for you, right? People who love us have a hard time sitting with our emotions. And so that repeated message over and over from parents, siblings, friends, partners, coaches, school, all of it, everything is going to cause you to lose what I like to call your internal compass of like what's happening for me, because you're just going to feel like you need to shut it down. And so for so many patients who experience like an emotional surge, the automatic reaction, the automatic learned reaction is to do whatever you need to do to get rid of that extreme feeling. And so there's very little time spent internally figuring out, what do I feel? What's causing it? How big is it? I only notice it when it's uncontrollable. And so, yeah, a lot of people come in like that. And I think, you know, again, I've definitely had experiences where I'm like, I have no idea. I'm so overwhelmed, you know, and it's tough.
I mean, when I arrived at McLean, I've talked about this on the podcast before for listeners. One of the first things we did was, can you name all the emotions, or like the top 10?
Yep.
And I'm sitting with people who are like in their 40s, who are mothers, who have lived entire lives, and even myself, and like can't distinguish the difference between envy and jealousy, or when they're angry and when they're sad, and when it shows up as another thing. And it's just so wild to me that this isn't taught in school.
It's not taught in school, and it's also not taught at home most of the time, right? It's just this inherent thing of like, oh, you know how you're feeling. That's not true. And I absolutely am obsessed with the fact that you brought up envy and jealousy, because that's a huge one that we don't know the difference between. Also shame and guilt. And so, and secondary emotions, like everything looks like anger, but is it actually anger? So I just like shout out to you, truly. Like this brings me so much joy as a DBT therapist to like see somebody really just like like it's part of you. That's the vibe that I'm getting. And so I love that. But yes, it would be wonderful if it was taught in schools. It is not.
I know.
And if you're like a typically developing kid, you get by one way or another.
Totally.
It's for the kids that aren't, that tend to be in the situation where they're not fostered or reinforced for feeling things. That's how we get ourselves into hot water, if you will. There actually is research coming out of Seattle, which is where Behavior Tech's, that's Marsha's company. It's where like all of their research is their base. So I think his first name is John Mazza, is doing stuff about school-based DBT, like implementing DBT in school counseling and stuff like that. So like,
hello,
like
that would be crossed. Amazing.
Yeah. So well, hopefully in our
even
lifetime.
like with first graders,
especially with first graders,
you know, like when you don't even understand what you're feeling at all. Like to me, that feels the same as like, okay, learning your body parts.
Yep.
Is like, this is how I feel, and this is why I feel it, and this is what it made me do, and breaking that down. Yeah, I mean, 100%. Well, I love having you here today. Just, I mean, that sounded like we're ending the interview. We're not. Sorry. But I mentioned this briefly before we started recording, but I feel like I get shit on a lot online. Not so much on my podcast, but people will ask me my experience with DBT, and I'll talk about my experience in treatment and with therapy. And I feel like I'm not the most succinct or eloquent when I explain it, but I'm trying to just talk about it from first person. So anyways, I love that you came on today. We can hear from like a professional's point of view, and you can kind of answer all of the questions that I know a lot of the listeners have that I'm not able to answer. So what are the 4 main components of DBT?
Okay, so do you mean, this is not complicated, but there's 2 possible answers. Do you mean like what are the 4 sets of skills?
Yeah, I guess like the mindfulness.
Yeah.
And
Education.
Psychoeducation was a huge part of this program, and it's really empowered me in my own mental health. And so I love to kind of have an element of that in these episodes.
Yeah.
And just, people are smart and they're interested and they want to learn.
Yeah.
Also, you're a teacher. So I'm like, I want to sit here and I want to learn and hear what you have to say, and I want my listeners to learn.
Fabulous. I appreciate that. Okay, so there are 4, I'm like putting on my teacher hat. There are 4 sets of skills, 4 modules of skills that we learn in DBT, and they typically like correspond to the stuff that if you have big emotions or borderline personality disorder or whatever, you tend to struggle with or have like a skills deficit in. And they are mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Do you want me to like go into them?
Yeah,
okay.
Of course. I mean, we can even like converse about it, but go for it.
Yeah, no, I would love to. That's the thing is like I think you probably know just as much as me, or you could describe it just as well as me because
probably not as well, but
see, I don't agree with that. Sorry, like I'm gonna be honest. Like I'm gonna challenge you on that. Like I think that if you're a DBT person and you say you are, and I've heard you, and this is why I'm so into you, for lack of better words, like you can describe, like that's the idea, is that when you're a DBT person, like it's an equal playing field once you get it.
Yeah, it's second nature. I mean, I did study it every single day for 5 months.
Literally.
And lived it. I would say I'm a little more rusty now, but
that's okay.
Definitely.
Okay, so mindfulness, right? It's not necessarily Buddhist Zen mindfulness. It could be. The way I like to think about it is this idea of focused awareness.
Mm-hmm.
So the idea that in any given moment you can sort of say, okay, what am I thinking? What are my body sensations? What emotions are these, if I can label them? And what are my urges, right? Like what is my body? What's my natural reaction to this? And you want to build up your focus muscle. So you want to practice bringing your mind to a specific place, whether it be a present moment, an activity, whatever it might be, because that muscle, that awareness plus building that muscle to focus and refocus allows us to utilize mindfulness when we're in a situation where we know we might do something that is not helpful for us or just like not in line with our goals or whatever it might be. It helps us to do the next thing, which is distress tolerance. So tolerate the moment more effectively by being able to refocus where we are onto something else.
Mm-hmm.
So we're not like intensifying the emotion or, ruminating on the urge, because that's just going to make us do it, right? Like we're humans. So that's mindfulness. Nothing exists without mindfulness in DBT, like, and in life. Like it's just, if you don't know and you're not willing to know, then what are you doing?
Mm-hmm.
And I don't mean to be judgmental. It's just like, how do you know what you're doing? So mindfulness really gives us choices. I love mindfulness. We love a good wise mind moment.
Yeah.
If like all of my friends, referred one of my friends, a good friend of mine, to DBT, and he'll like frequently say to me, let's use our wise mind. And I'm like, bro, like you don't need to fucking remind me, but like so happy that you're thinking about these things.
That's
like,
something I miss about being at McLean, because I was in like basically a sorority house with people who were doing DBT all day, and so we would have all of these like, joking about like, yeah, use your wise mind, or use your, what are your please skill, or like all the different skills. And now I'm like, I miss that.
I'm gonna text me
I
anytime.
miss group therapy.
Literally text me anytime. I'll be like, what skills did you use today? That's this same friend of mine. He's like, I'm having a hard time generalizing my skills. Can you text me and say to me, like, reminder to use your DBT skills? So I like did that for like an entire like full week. And he's like, okay, you can stop now. But, like, and I would send like, yo, do your DBT skills, or like different weird things. I'm like chuggy every single day.
It becomes part of your life.
Yeah.
And like how you live it.
Sure. And that's the same thing for clinicians. Like it's one of the first things I learned when I was trained in DBT, is that like you really have to live the treatment. Otherwise, how can you teach it? Like how can you guide someone through like changing their life if you're not actually living that way? It's the same thing as a mindfulness practice. You can't teach mindfulness if you don't have a mindfulness practice.
Totally. Or it's like a nutritionist or someone. Like,
Yeah.
how can you tell someone to have healthy behavior, or a workout instructor if they never work out? Like, that's ridiculous.
I mean, it confuses me when like medical doctors smoke cigarettes, but like, I get what you're saying. But I guess like on that same, the other side of that is that like every human being is fallible, right? So while I do my best to live the treatment, that also means that I'm a human, and there are times where I am ineffective, where I am an emotion mind, where I do, you know what I mean? And that might even come out in session, and that's something that, like, you know, that gets worked through in session. There will be times where I might get frustrated with a patient, and like I might go a little hard on them, and then I'll realize that maybe I wasn't as effective in communicating what was going on, and so I'll call the patient after and be like, listen, I had a really strong reaction to that. Here's why. Here's what was going on for me. And while I think that what I had to say was important, the way I said it was not effective, right? So every moment is a teachable moment for both the clinician and for the patient, right? I'm modeling there the fact that I am infallible, the fact that I can take feedback and give feedback to another person, and I don't personalize it. I can model that when you make a mistake, it is solvable. I can model effective interpersonal communication, like taking a responsibility. It's opposite action to shame and guilt, you know? So I'm doing all of the things, and, you know, it all has meaning. Everything has meaning in DBT, and I think that's like the most important thing about DBT. But we were supposed to be talking about the skills. Like, sorry. You're like,
you're really selling it though. No, in a good way. Okay, so we have mindfulness,
distress tolerance, which is how do I get through this moment without making it worse, without necessarily making it better. So the way I like to talk about that, I talk about that on my professional Instagram, which I was inspired to open because of you. Because I was like,
really?
she talks about DBT so effectively. I'm going to do this because I have a big problem with the internet. But so it's like, how do you stop doing the things that aren't helpful for you, and yet you can't stop doing them anyway, right? So that's whatever thing you need to change. It doesn't have to be a dangerous behavior. It doesn't have to be self-harm or suicidality. If it is, that's okay. It can be like impulsive texting. That's my pick your poison. I'm an impulsive texter. Like 2 a.m. and I'm like, hey, like, and then I'm like, no, Maddy, go to sleep. You know, it's anything that you feel like is getting in the way of like a certain area of your life feeling the way you want it to. And so there's a cajillion skills that are basically like crisis management band-aids, right? So these are not the skills that are going to make your life better. They're the skills that are going to prevent you from making your life worse, because you have to stop doing the things that are actually making your life worse before you can improve, before you can take that blueprint and like build a foundation. You need to first clear away the stuff that just can't be there. You know, so that's distress tolerance. I love distress tolerance. And you can't distress tolerance your life away. You need to then figure out how to build a life worth living. But we also in distress tolerance have radical acceptance, which I won't go into now, but one of like the most important skills and one of the most challenging skills, I think. So distress tolerance just helps us get through moments, right? So that we can practice literally tolerating the way we feel and not reacting to it.
That's the easiest one for me to talk about.
Well,
yeah, because it's like the actual skills of, you know, like putting your face in a bucket of ice water, or like you know, certain things that I feel like are very easy to visualize and then talk about, like, okay, it actually, you know, it affects your parasympathetic nerve, and so it slows your heart rate. Like, to me, those things are very easy to explain, whereas some of the other ones, even like radical acceptance or some of these other parts of DBT, have always been a little bit more difficult to go into.
Yeah, well, it's like they're maybe less tangible. You know what I mean? And it's really kind of like XYZ with distress tolerance. Like, this is the triggering situation, this is the urge, I'm going to do this instead, right? And that's why we have phone coaching. But yeah, distress tolerance is wildly important. It just prevents us from doing stuff we don't want to be doing, even though, let's remember that those behaviors are serving a function for us. Like, they're doing something for us in the short term. We just need to find replacements for them.
Yeah, it's relieving. Like, here's a perfect example. A friend of mine was kind of going through a breakup recently, and you know when you can feel someone pulling away? Like, her boyfriend hadn't been texting her for a few days, basically. And I was like, in my head, I'm like, use the stop skill. Don't text him like 100 times. And to relieve her own anxiety, I felt like she was, would check in and text him a bunch. And I'm like, it almost becomes like a double entendre, or you're almost like making the situation work because it's hard to sit with that anxiety.
Sure. Like when we act on our urges, it generally is making us feel better in the very short term. Exactly. And will usually make us feel worse in the long term. Whether it's 10 minutes later or a month later or a week later, it doesn't matter. That's the problem with these, like being in emotion mind and acting only from emotion mind. It's just that it's actually not leading you where you want to go, which is why it has long-term like harmfulness. But short-term, it's like you're giving your emotion, you're feeding it, you're giving it exactly what it wants. And so it goes down, but then there's consequences.
Definitely, yeah.
So that's the stress tolerance. We love a good tip skill, by the way, like ice and face water. That's like very popular on social right now. Is emotion regulation. So emotion regulation is the like what I like to call life worth living skills. So these are not your moments to moments. These are your lifestyle building skills. And so they're kind of split into two sections. There's changing or lowering emotions in a moment. So that's opposite action and problem solving. And again, a lot of these things are kind of inherent. It's just that we're relearning them with a different level of mindfulness and like skillfulness and intention. So there's problem solving and opposite action. Opposite action is like one of the most important skills that we have in DBT. It's like, how do you, if you don't want to increase an emotion, you got to do the opposite of what it's telling you to do. Thank you. Not accustomed to this. And then their other set of skills are the skills that, again, these lifestyle skills, which help us actually like change our emotional baseline. So we're regulating emotions before they even happen by reducing our emotion vulnerability. And this looks like becoming more mindful of positive things when we're doing positive things with intentionality. And they could be small things or big things. Setting goals and actually being able to achieve those goals, right? There's so many things we want to do, and yet like it's actually very hard to get from A to Z. And so like, how do we set tasks and like hold ourselves accountable to doing the thing that's going to slowly get us where we want to go? Mm-hmm. Coping ahead. So like, I know this thing is going to be triggering. How am I going to get through it? Like, let me sit. I have done so many times where I have like needed to have a difficult conversation with like a friend. I sometimes have a hard time giving friends feedback. Because I feel guilty and whatever. And I have like literally sat in front of the mirror and like talked. And then I was like, well, everyone's going to think you're ridiculous because nobody talks like this but you. But like, it's really helped me. Been like, this is how I'm going to do it. Like, I'm imagining myself being successful. So planning ahead, not avoiding triggers, like knowing what you need to do with the please skills. So mind-body connection. Oh yeah, that's it. ABC, please. Okay.
No, I think that's a really good example of, like, let's say, I'm going to go to this party. I know my ex-boyfriend's going to be there and I'm going to run into him. Like, okay, let me cope ahead. But also, what's the worst thing that can happen? Yep. Like, if this goes south, this is what can happen. And so here's how I'm going to prepare for it.
Yep. Exactly. And like, I really think in DBT, and like, I'm curious to know what you think, we're really very much so like plan for the worst, hope for the best. Yeah. Right? Yeah. It's like, you better have a plan F. Okay. Like A through F, you will have a plan. And you're going into something without the attachment to the outcome of this is going to be awful. Mm-hmm. Right? So yeah, but we're like super prepared.
You're saying it's really hard to go from A to Z. Yeah. So like if you set these smaller goals that
build mastery.
Can you explain that?
Absolutely.
Thank you.
So build mastery is the idea where when we're setting a goal, actually, this is like one of my favorite skills. I'm so glad you brought this up. I'm thinking about it. And I'm like, actually, I'm obsessed with this skill. It's like, and it's low key, like not talked about that much.
It's not talked about that much.
It's amazing.
Hence, I couldn't even remember the name.
Yeah, and it's fabulous. And you remember that it was a thing. So like, we're doing great. So build mastery is the idea that when we're setting a goal, it needs to be hard enough that it's a challenge, and not impossible. So I used to do ballet as a kid.
I did ballet too.
Oh my God. So this is an example that I bring to group a lot. It was like, if I have a goal of like wanting to get back into ballet, like that's great. My goal cannot be like to join the American Ballet Company. Like that is not going to happen. And so I'm setting myself up for failure. I'm creating something that's too big, and then I'm going to overwhelm myself and I'm going to run away. Because like I'm not gonna be able to do that. And if I just say to myself, like, I just want to go, like, you know, I'm gonna do a releve in my mirror, it's not a goal, right? So maybe my goal would be like to spend a month going to a class every week. Okay. And so if that's my goal, because I'm not doing it now, if I was doing it, I'd be like, if it was easy for me, I'd be doing it already.
Mm-hmm.
So then I need to break down what steps I need to take in order to get myself to that class every week. And this could just be like step one of my goal. But for example, so I'd need to, you know, think about what like clothes I need, if I need ballet slippers, which I would buy anyway because it's chic. You know, I'd have to research classes and find one that I like that works in my schedule. And then I'd have to like figure out a plan for me to actually get myself there, right? So I need to be mindful of like time of day because maybe I'm a morning person or maybe I'm an evening person, and I'd have to be mindful of like location and what am I going to do that morning? Am I going to get up and go for a walk and then get to this place? Like, how am I going to get myself there? And all of those things need to be thought about. All of those things are little tasks that get us to the goal of getting myself to the ballet class. And then I need to do them all again the following week, and all again the following week, and all again the following week. So I love this skill because it really teaches us self-efficacy, or it's like the idea that if I can do something, then I can do more somethings. And that to me is like the essence of like happiness.
Self-esteem.
Yeah. So like it's the essence of being like, okay, like I'm capable. Like if you don't believe that you are capable of like taking the reins of stuff in your life, big or small, like that is what leads people to really, really dark places.
Mm-hmm.
And so even if it's, I'm going to figure out how I'm getting out of bed in the morning, and sometimes that's where people are starting, and you get yourself out of bed, you're like, I go apeshit about this stuff. I'm like, holy fucking shit, you did a thing that you haven't done in forever, and you did it yourself, right? And then so it's this idea again, self-efficacy. If I can do this, then I can do another thing, and maybe I could do another thing, and then all of a sudden you have the capacity to problem solve because you've proven to yourself that you can do it. Like, I love this shit. This is amazing.
Can you explain please skills is also part of this section?
Yes.
Okay.
So Marsha Linehan, God bless her soul, we love this girl, woman, Dr. Marsha Linehan. We love you, bestie. Loves a good acronym, right? So please skills stand for take your prescription medications as prescribed. E is exercise. E is exercise?
Yeah.
So
oh my God, the P is treat physical illness.
Yes.
So that's like take care of your body.
Yes.
So take your medicine, exactly.
Yep.
And that's the P and the L, I guess, randomly. And then the E is eating.
Okay. E is eating.
A is avoid mood altering drugs or substances.
A is substances. Yeah. S is sleep. E is exercise. Okay. God bless your soul. That is extremely embarrassing.
No, Mash, don't be embarrassed at all. There's so many different things, and you're teaching and you're seeing patients. So
Thank you.
Don't fret it.
Thank you for the validation. I appreciate that. So essentially it's like a lot of these things in our life tend to be like out of whack, like off balance, and any of these kinds of mind body thing or body things that aren't being done in, like I said, a balanced way tend to affect our mood. It's right. If you feel like shit physically, like you're going to be more
susceptible.
Yeah. Like also like hangry.
Mm-hmm.
Like I am a misery when I haven't eaten. It's like I get to a certain threshold where I'm like, I will kill you if you come anywhere near me. And so I carry snacks home, right? So it's really about bringing, like, assessing for yourself, mindfulness in each of these categories. So taking care of my physical health, PL,
yeah,
eating and food stuff, which can be very triggering. So you really need to be mindful of that. We are very mindful of it when we teach in group as well. Substances, etc.
Yeah, if
like
you're really
sleep.
hungover, I'm going to be way more moody. Or if I haven't gotten any sleep last night,
right,
I'm going to be more susceptible to, like, if someone says something that I interpret as rude, that maybe if I was getting good night's sleep, taking my medication, not hungover, it would fly off the radar. Like, it wouldn't bother me. But if I haven't slept, then maybe I'm going to react emotionally to it.
100%. Right, exactly. Or like knowing what works for you in terms of substances. It doesn't have to be, and some of the DBT gods are going to be mad at me for saying this, and this is just what I believe. It doesn't have to be abstinence. It has to be mindfulness, right?
Mm-hmm.
Same with food. It's not about, eat whatever you want or, restrict. It's like, how can you, the way I like to think about it is like just being balanced and like have it take up less real estate in your mind, because that's a huge deal. Tolerating your body. You don't have to love your body in order to tolerate it. And that comes with also like food and exercise, right? So a lot of times if we're having a hard time with our body, we're going to engage in ineffective behaviors with food, which is going to make our mood even worse, or we're going to engage in ineffective behaviors with exercise, which is going to make our mood worse, whether that be avoiding exercise or over exercising. Both of those things, anything that's off balance is a problem. There's no one particular thing that's like really problematic. It's really about when things are not being weighed out equally. Sleep. Sleep's a big one. Sleep is so hard for most of us. There's actually like several really effective ways to alter your sleep so that it's like it's actually easier to change sleep than all of us think it is, and we get like panicked about sleep. But not oversleeping, not undersleeping, balance.
Yeah,
having
a schedule.
Schedule is vital. Consistency is vital. I can like literally give a TED talk on this.
And then, okay, so we did mindfulness, we did emotions, we did distress tolerance, and
now we have interpersonal effectiveness, which is my favorite set of skills. I love interpersonal effectiveness because I think that it is just like, it's so hard to get along with people sometimes. It's so hard to get your need met. It's so hard to ask for what you want. It's so difficult to like, say no some of the time, or to not avoid, or to not snap at someone, or how do I build a relationship? Like these things are just not easy. I just love these skills. It gives you a script, right? Which you don't always need to like stick to adherently, but it helps you figure out how to be the version of yourself in relationships that you want to be. And that's the most important thing, because there is no skill in the world that is going to get someone to do, think, be, behave, whatever, what you want them to be. Obviously, if we are more effective, the likelihood of someone else being effective in return is probably higher. However, at the end of the day, you're only in control of you, yourself, and you, like your behavior, your emotions, your thoughts. And so the real goal of interpersonal effectiveness is did I walk away from that interaction being the person that I wanted to be in that particular interaction, in this particular relationship? And that's like, sometimes people get frustrated because like, oh, I still didn't get what I wanted, or the person was really rude to me back. And I'm like, how'd you feel though? Like, what did you do there? And that's what's most important, because if you're being mindful of what you need, you're never going to walk away from a situation feeling like shit forever, because you upheld your values and you were the version of you that was important. And so if someone else has an issue, that's their shit.
Mm-hmm.
Can't control their shit. And you can control yours.
You.
So many of us, especially women, I think, like carry around this like guilt, this like internalized guilt. Like, how many times a day are you saying, oh, sorry, when you actually haven't done something wrong?
Mm-hmm.
And so like helping, like learning how to be assertive, and like learning that being assertive is actually not offensive. It's like not aggressive, and learning how to like have a voice and like have your values is just not something, as much as like, women are like, we are living in 2023, thank God, but like there's still this like air of like, there's something wrong with you-ness. Your Instagram story today, people like shitting on you for saying like.
Yeah, shitting on me for that. And then I'm looking at the research because I got pissed off.
I love that. Good
and
for
I'm
you,
like,
by the way.
actually, if you look at the percentage of like women who ask for a raise, it's like so much lower than men, because again, we're taught to not speak up, not be assertive, because if you are assertive, you automatically get labeled as like a bitch or bossy or narcissistic. And I say this all the time. I'm like, if I was a man, I would not be getting the same shit. Yeah, someone commented being like, you guys were saying like a lot in a clip for my podcast. And I was like, actually, if you look at the data of why women say filler words, it's because we're thinking about what we're saying more.
Yeah.
And being intentional, because we get interrupted more.
Yeah.
And if I was a man using a filler word, which they do use them just as much,
sure,
they just use and instead of like or sorry.
Yeah.
Then like, would this woman have commented on my Instagram if it was two men speaking that way? Like, probably not. And the reason that we say sorry and like is because exactly what you were just mentioning, were socialized to be extremely apologetic and take up less space from like a very young age.
Deferential, right? And especially if you're a sensitive person, if you're a person with big emotions and you're a woman, I mean, the idea of asking for what you want, like being direct is like, seems impossible. It's just, it feels wrong, right? And so
like untangling that.
100%. And so like, if we have a set of skills of like, how do you do this? And even like helping people, you know, like, okay, can you start this in an email before you have the meeting? Can you ask for the meeting in the email? Like, it just like shaping the behavior towards that and like helping people see that there is actually a way that, and like, it's not offensive. You're not being offensive. It's not offensive to say no. It's not offensive to ask for something. It's not offensive to tell someone that they did something that wasn't okay with you. It's actually not offensive if you do it in a non-offensive way. Is like the best thing ever. It's just the best freaking thing ever.
And like when you hold it in, then that's when you're gonna like pop.
Yeah, you're gonna explode on someone else for like no good reason, or on yourself.
Or live a life that you're just like unhappy with because you never got promoted, or you never were like living the life or having the career that you want because you're not asking for the things that you need.
The irony about this, I think about this a lot when I talk to patients or I talk to my friends, or I'm thinking about myself with dating, right? And it's this idea of like, oh, like I wish that he would do X, Y, and Z. And I'm like, well, I mean, same, by the way. but then I think about it and I'm like, well, did I ask for that? And there's this thing, like, there's this culture, like, don't be direct in dating. Like, and I always say to people, like, well, nobody's going to read your minds. Like, you can't
no one's a mind reader.
No one.
But then there's all of these weird dating rules where, like, men, and they do study this stuff, but, like, people like the chase. And it's like, how do you navigate? It's really difficult.
This is why we all need DBT from age 0. Because the chase is... I cannot.
My best friend in high school, this is just a random story that's coming up for me. And I knew it was wrong back then, but now what I know as like an adult, I'm like, fuck. So we were going to a prom. She had asked her boyfriend who went to another school, and she really wanted to go to, like, people would go in different dinner groups. And she really wanted to go with her best friends. And so we're like making plans. And then her mom was like, no, if you're bringing someone from another school, you need to do what he wants. And like allow him in his friend group. Or like to go with the friends that he's comfortable with. And even at like 15 or 16, I was like, but it's your prom and it's our school. And I think if he's your boyfriend, like, you know, it's your friends. And when you go to his prom, I think you can go with his friend group, but this is important to you. And it's like one of our last events together. And it was just so funny. I even knew at that age, like, it was so strange to me that her mom was kind of being like, well, you have to be polite and you have to do what he wants and you can't speak up for what you want.
Right.
And just interesting to see how we're so socialized in these ways we're not even aware of.
It's so interesting, and like I'm actually really glad I'm having this conversation with you because like you're the sex goddess, whatever. And it's interesting for me. So I'm divorced. Then I lived in Israel. I had a serious boyfriend. Then we broke up. Then I was dating in Israel, and so this is really my first time dating in New York. Like as a 34-year-old, like very new for me. And on the one hand, I think like the wise mind part of me is like I don't really want to engage in these rules, these dogmas that like just don't. Like, where are they coming from? They just all feel like shoulds, like says who. And on the other hand, when I'm in it, I get all of this anxiety of like, well, what should I be doing? And it's just so interesting to see the overlap of like me and this is why I said I'm just a regular girl, because like me as like a single person in New York City, and me as a person who thinks a lot about stuff because I'm a DBT therapist, and like the overlap and where that interacts is just so hard. And yet like this is where I really try to lean on my skills of like what's effective for me, what's my goal in the moment, what do I need right now, right? What's the long-term and short-term consequences of this situation? Make the decision that way.
Yeah, what are my values?
Yep.
You know, don't text him first is a classic one that I feel like women get told, especially in New York or LA.
Yep.
Like, yeah, there's these arbitrary dating rules and we must stand by them. And then I'm like, but I don't want to be in a relationship that is built off of these false pretenses where you're into me because it's the chase and it's something you can't have versus I want someone who chooses me because they're interested in who I am and what I have to offer.
Yeah, like we all do this mind reading thing in dating or with friends, like, and this is a DBT thing. So like, it's like the moment that you are experiencing that I think they feel or I think they think, like you need to pause and you need to say to yourself, like, is this fact? Check the facts. Is this fact or is this the narrative in my mind from my emotions and from my experience? Because the moment that we step into someone else's internal experience and make decisions based on their perceived internal experience is the moment we step away from reality. We have no idea what is going on for someone else, even if we end up being right. It's actually worse when we end up being right because then we're like reinforced for these assumptions that we're making. But like, whoa, Jesus. Even if we're right, we living in a way where we're making decisions based on what we think will get something from someone else without being direct or asking a question is just so dangerous. And this is how you end up in a relationship or a friendship or a dating, whatever, like losing whether or not you actually are enjoying the person and spending so much more time on whether or not the person is enjoying you.
Oh my God.
And keeping them around. Right now, I'm obviously I have struggled with this tremendously. I talk about this day in and day out, right? We don't want to wake up 10 years from now with somebody that we realize we don't actually love that much. I did that. We don't actually love that much. We don't share the same values because we were so invested in making sure we weren't going to be alone or making sure that we were likable enough that we totally lost our ability to assess what was going on for us in the relationship.
Yeah.
It's huge.
Yeah, I feel like I mean, I see this with my friends all the time there. And I text my friends the same thing. I'm like, oh shit, this guy, like a couple months ago, I hooked up with someone and then they kind of stopped texting me. And I immediately could have just assumed, oh, he's not into me, or did I do something wrong?
Yeah.
Is he not he's not attracted to me? Like, was I too intense? Whatever, all these million different reasons. Judgments. But then I texted him and I was just like, hey, like, what's going on? And he was able to have a conversation. And I'm like, okay. I think a lot of people get their egos involved as well.
Sure.
And they're like, oh, well, I don't want to be rejected. Like, so many people, we all fear this rejection.
Totally. I hate rejection.
Totally.
And one of my best friends also, my friend Jessica Siskin, we love her, shouting out all my best friends on this pod, said something really wise to me once that I really liked and I think about a lot with dating is like, if you're doing it effectively, she didn't say effectively, but if you're doing it right, you're not going to be everyone's cup of tea, because if you're everyone's cup of tea, then what are you? Like, who are you? Like literally, who are you? Right. And so what are we masking? What are we doing? What are we trying to put across as opposed to actually being who we are? How are we supposed to find someone that's right for us if we're so afraid of being intense or this or that or the other thing? Believe me, I've gotten that feedback. Like, you're great, but you're like, this guy I was hooking up with, like, I love you so much. You're an amazing human being, but you're just like a lot. And I'm like, fuck, like what? And it really hurt me. And then I was like, okay, that means that this person's not for me, right? You need to sort of be yourself.
And selective.
Like,
you don't want to date just anyone who you pick up off the street.
No. Right. You don't just need a warm body. And
oh my God, my therapist, is that a DBT term?
No.
She says that to me all the time.
Okay,
she literally says warm body.
Like, this is why DBT people are literally the best
She's
people.
like, so you need to stop seeing that guy because he's just a warm body in your life.
Right.
You don't even like him. He's a warm body.
But it's true. You don't like him. Like, isn't
I know.
True, though? I'm obsessed with that. Yeah, shout out to your therapist.
She says that all the time.
Love that for you and for
hilarious.
her.
I've never heard someone use that term.
I use it all the time. But I didn't know, like, maybe it's, I don't know. I think all of us are just quirky.
But here's an example. Like, I haven't been texting a couple of my friends back today because I ran into my ex-boyfriend a couple nights ago. And I haven't seen my ex-boyfriend in a really long time. Yeah. And it didn't, like, throw me for a loop, but I've just been... It was intense and it was a lot, and I'm just trying to figure out how I feel and be slow.
Yeah.
Slowly, like, decipher the situation. Sure. And I'm sure some of my friends, if they were more anxious leaning, would be like, oh, she's not texting me back. She's mad at me. Oh, what did I do that she's not texting me back? So I literally posted on my close friends being like, sorry if I'm not responding to you, like, just going through something or, like, dealing with something.
Like, can I be on your close friends?
But it's like, yeah, when you assume, oftentimes you
end up stepping into the situation that you don't want to be in.
Yeah.
Right? That's emotion mind. Bringing it all back together. I just took this on a dating tangent, but I think it's so relevant.
I think it's very relevant for my listeners too, and like the age bracket, and that we're all trying to navigate this stuff, and it's difficult and it's confusing.
Yeah, and it's just fucking hard. New York City is wild. Like I said, I've never dated in New York City I got married at 22.
22?
Yeah. Yeah, insane. I used to be Orthodox Jewish. I have had like 50 identities.
Okay.
I'm well suited for DBT. And yeah, it's a wild world. It's given me so much more empathy for everyone else that I'm treating or other people in my life, because it's really, really hard. It's really hard to be skillful in dating. It's like really, depending on like your stuff and how you feel about abandonment and all that, like really gets tested in this world of dating and constantly trying people out and rejection
and the dating apps and the fact that like you walk out your door and there's 100 new options.
Right. Or you feel like there's zero options. It's really hard. And then this is the idea also, I think, in DBT, where it's like, it doesn't, because it's difficult or because I'm having an emotion, doesn't mean that I need to stop doing it or that it's dangerous or that I'm not okay. It's like, how do you tolerate a certain level of distress, rejection, emptiness, right? Because if I'm not tolerating these things, I'm either going to completely avoid or I'm just going to like bulldoze my way through dating. I'm not actually being mindful, and I need to be able to be okay with these things in order to actually find a partner, find someone I connect with. If I can't tolerate being rejected, then, well, I'm just going to end up with someone that's not right for me.
100%. I lived my life like that for many years.
Same.
With warm body after warm body.
With warm husband who's a fabulous man, but totally not suited
right
for me.
For you.
Just totally not right for me. And I was so afraid to leave. And I was so afraid of what other people would say. I spent 5 years in therapy trying to figure out how to leave my marriage. Sorry to my ex-husband if he hears this. You're just a really nice guy.
There's a lot of stigma though in that community also.
Yeah. And like just the shame, right? If you think shame is such a strong determinant in behavior, I think, and I think especially for women, like shame is just, it's like, what's he going to think of me? What's she going to think of me? What am I going to look like when I post this on Instagram? Right. And the idea that like at the end of the day, you need to learn to operate based on your values and your goals, because there's always going to be someone that has something to say. We can't control someone else's judgments. And that was sort of what really allowed me to get divorced, which was a really good decision for both me and my ex-husband. But it's the same thing. It's like, get divorced. Okay. Like post a picture on Instagram, post what you want because it's within your values, because guess what? Yeah. Some people might say you look like a slut. Like, okay. Like, I don't care. My own sister, who I love and adore to my best friend, will sometimes be like, why did you post that? And I'm like, did anyone ask you? Like, no offense, but like, did I ask? And she will listen to this and she'll be like, why are you trashing me on the internet? No, we're obsessed with Jordan. She's amazing to my best friend, but like, okay, I wanted to do it. I can sit with the consequences. Other people are going to have something to say. It doesn't matter. Doesn't matter. You have to act within, like I said, your goals and your values.
What's empowering for you.
Yeah, like just what works for you.
I feel like that kind of ties into this acceptance piece a little bit. Because
Yes.
I feel like that is a huge part of DBT and it deserves its own section.
Yes. So DBT straddles the dialectic between acceptance and change. As a DBT therapist, one of the things you learn in your training, like when I was being supervised, was like, where do you fall on that dialectic? I definitely am more of a change-oriented person. I am a fix it, do it, change it.
Oh, me all the way.
Like, and I think a lot of successful or success-oriented or driven people tend to be. And so this idea, I'm always trying to be mindful of what I need to accept and what I need to validate, both in my personal life, for my individually, and with my patients. And the idea of acceptance is so wild because acceptance actually gives way to the opportunity to problem solve differently. But it's this idea that you're not giving up. You're not happy about something. You don't have to have a positive emotion in order to accept. And at the same time, you're no longer trying to change a thing that you cannot change. Like, makes me want to cry thinking about it. It's so hard. Like, it's the hardest thing ever. And, you know, it could be something as trivial as sitting in traffic. Like, think about how aggravating it is to, like, be stuck in a cab or an Uber and, like, you had to be somewhere 20 minutes before. Like, as big as not getting the job you wanted,
Or
having a
someone
breakup,
passing away.
somebody dying. Absolutely. It is. And it's, again, it's this idea of like, this is a practice. It's not, I think it is not natural human experience to not want to change something. And yet when we try to change something that we just can't and have tried to and just can't, then we suffer, right? The what if I, or if I just do this, or had I done this, those are all suffering thoughts. And like, I think that we all at some point experience some suffering in every emotional situation until we're ready to accept the pain. Suffering is ultimately a choice. And
that's like the big kicker of DBT.
it's huge.
It's like, what is that quote? It's like, we can't, we don't have to condone or there's things that happen in our life that are completely out of our control, and yet we are in control of like how we continue to live our life or how we react to it.
The best dialectic ever is, we may not have created all of our problems, and it's still on us to solve them or respond to them.
Oh,
I know. It's like poetry.
This is a good reminder for me this week, honestly.
I'm so happy to hear that.
I'm like happy we did this week.
That like brings me so much joy to hear, like truly. I'm like,
I mean, even
glad.
this morning I was like, oh, I'm having a bad day. Like, I don't know if I'm like down to do an interview or no, it has nothing to do with you. It's just like,
obviously,
the stuff that's going on in my life.
Yeah.
And I was talking to my friend and they were like, I honestly think like when you go and do it and it's over, you're going to feel so good that you like got that out of the way. And it's the mastery and it's the accepting the situation in my life. So
distraction.
Like this meeting a new person and talking about something that is, I truly believe and live and find important. So it's kind of fun to be reminded of how this stuff pops up in everyday life.
Sure. And it's like hard to remember, and it's especially hard. The reason that these are skills is because like when we're going through things, like, it is very, very hard to remember that there's another way. And people have bad days. That's also like sometimes, especially if we're people who have come out on the other side from DBT or whatever, it's like, oh my God, there's this strong reaction to like, oh my God, I'm having a bad day. Like, does this mean I'm going downhill? And it's like, a bad day isn't a bad life. You're actually entitled to feel your feelings. And it doesn't mean that tomorrow you need to feel the same way. But accepting that you feel those feelings will then allow you to not get stuck the next day. Because if you're not going to accept it and you just pretend it's not there, then it's going to linger, and you're either going to like, avoid life, or it's just gonna.
We live in such an avoidant society too.
Man, don't even get me started.
Avoiding with social media, avoiding with
everything,
substances,
just everything,
and like normalized to drink all the time, like all these different things. You mentioned briefly that one of your patients was maybe calling you, that it would be part of phone coaching, which I know is very specific to DBT. Can you explain what that is?
Sure. So phone coaching is one of the components of DBT that is this idea that patients have the ability to reach out to their therapist, depending on what their therapist parameters for phone coaching are. Mine are 24 hours, 7 days a week, unless I'm on vacation. Different people have different parameters, and that's okay. Like limits to when they can be acceptable. But it's the idea that if you're having a moment, a high red zone moment, right? A high emotion moment, and you know that you want to do things differently, and yet you're either have tried stuff and it's not working, or you don't know what to do, you call your therapist, and your therapist is like, okay, cool, we're gonna get through this. Here's what you're gonna do. It's amazing because it gives people the opportunity to do something different in the moment. And this is the idea that you said before, where you're like, yeah, it's really hard. Like, you can talk about doing things, and then actually doing them is really hard. Like, being able to call your therapist and have them be like, I'm in this shit with you. Like, go fucking do this and don't call me until it's done. And I will often have patients send me selfies or FaceTime me, or like, it's accountability, but it's also like, I'm here in this with you, so you better do it, right? We're doing this the right way. We're doing it now. It helps people learn the skills, right? The idea is that eventually when people call me, let's say like 6 months in, I'm like, oh, what have you tried already? Right? Because we've gone through this. You've learned this stuff, right? It's passing the baton. But when you're beginning treatment and you're wrapping your head around all of this, you're not sure if you want to wrap your head around all of this. You're not sure how to. You're not sure if you at the most extreme level want to be alive, you need somebody on your team, and you need to be able to do those things moment to moment. And so that's phone coaching.
How do you navigate that?
So
on a personal level.
I sleep with my phone under my pillow. I don't suggest that for everyone. People that I'm dating or like whatever, I'm like, listen, I just want you to know my phone might ring in the middle of the night. I step out of a lot of dinners. Doesn't mean I don't drink. Doesn't mean I don't microdose. Doesn't mean I don't whatever get high. I'm sorry to everyone listening to this with my patients, but they basically know this anyway. You have to really, and this is where mindfulness as a DBT clinician comes in, like you have to, and supervision, right? So I've been doing this for a long time. So when I supervise people, but also when I was first learning this a bunch of years ago, like you have to know what your limits are, right? And so I know I'd rather my patient call me in the middle of the night and me be able to take care of it in that moment, whether it be stopping them from sending an impulsive text or stopping them from self-harming or helping them stop themselves. I'm sorry, is actually what I mean to say. And if you're a person who can't do that, then you say, like, my phone coaching hours are from 7 a.m. to 10 p.m., but I know for me, the time is fine. I have a very specific set of, like, rules that I tell people always. And one of them is crises don't usually start at 3 a.m. Don't fucking call me at 3 a.m. unless it's an actual huge emergency. Like this, but the goal of that is to help people think more about when a crisis starts as opposed to calling me when the crisis is at Chernobyl level. You know what I mean?
Yeah.
So it's not just to protect my sleep. It's actually to help somebody become more mindful of the process of where they go from 0 to 100. It doesn't usually happen that way. It actually is 0, 60, 70, 80, 90, 100, right? And so if you can catch me at 60, you're much better off changing this behavior and changing this thing and getting through it effectively than if you tried to change it at 100. That's really shitty. And you still have to stay with a 100 because you're still not acting on the urge. So I have certain things that I tell patients, and my patients, like, because I'm so intimately involved with my patients and so genuine, like radically genuine with my patients, like my patients, like similarly, like go hard for me. Like my patients don't want to like
bother you.
Or like override my limits. Like, I think sometimes when people are afraid of bothering me, I have to give them homework to like call me 3 times outside a session, like just to like shoot the shit. I literally there were people be like, but I don't want to bother you. I'm like, if you were bothering me, believe me, I wouldn't answer. I'll tell you if I can't answer. And so I like make people call me like at random times and be like, hey, Maddy, like I'm watching TV. And I'm like, that's amazing. What are you watching right now? Like, same. I'm watching The Last of Us. I'm sobbing. But yeah, so it's just about like knowing your limits, right? So don't call me in the middle of the night. Like don't call me past 1 a.m. unless it's a serious emergency. You're just not going to get the best version of me. You have to leave me a voicemail. Otherwise I won't call back because you need to ask for what you need. You need to ask for what you want.
Okay.
Right?
So that's how you do it.
That's how I do it. I'll answer, but if I'm available, but if I'm not available, if you just call, and this was a big thing I had to learn to tolerate. If you just call me without leaving a voicemail, I will not call you back. I will presume it's a butt dial because you are not being effective in expressing what you want or need. You need to leave a message and say, hi, Maddy, it's so-and-so. Obviously, everyone's saved on my phone. Like, hi, Maddy, like, here's what's going on. I'm okay. Please call me back. Like, I'm safe for now. Please call me back. And I will always, whenever I get a call from someone, if I can't answer the moment, either I'm in session or like in the shower, those are really the only 2 times that I don't answer, or if I'm like having sex with someone. I generally try not to answer a coaching call, but like
you're like, I actually have to step out. I need to take this.
By the way, like you laugh, but like there was one time a scenario like that was
it's like it's being a doctor and it's being on call though.
Yeah, it was weird. But
like if you, and especially if you're working with a population for the most part that tends to have life-threatening, if you have a patient being like, I'm gonna kill myself, like that's something you need to take. And
Yep.
So I feel like people are understanding.
I think it was I might regret saying this because my patients will listen to this and it's fine. I think it was like a blowjob situation. Like, no. I have to take this. I'm so sorry.
And how would you know though who's calling?
I have my patients in my phone, but they're all in my phone coded. So like it's not their names to protect their privacy.
Oh, interesting.
Yeah. So you wouldn't be Eileen. You would be a variation of your last name and your first name combined in a certain way that I would know like who you are.
Yeah, because there's all these, crazy HIPAA.
Yeah,
stuff.
right. I just I don't want to compromise anybody's although I do have a lovely patient who will definitely listen to this, who was doing egg freezing, and she was having a really hard time doing the injections. And so I was out to dinner, and she was like, I'm freaking out. Can you help me? And I'm like, yeah. So she FaceTimed me, and I like put this phone under the table. So I was like, listen, I can't have anyone see you, but let's do this together so I can coach you through taking the shot. So like I said, like I'll do anything for my patients as long as they're also effective in return. Because ultimately that's the only thing that will benefit them. Like they need to be effective. And if I can't take a call, I always tell people I'll call back within an hour. I will usually send a text if I get a voicemail, and I'll say, 1 to 10, how serious is this? And my patients will be pretty forthcoming with me. And if I have to step out of a session, I will.
Yeah, that's my therapist. She's like, you can always text me and I will get back to you as soon as I can.
Yep. But I don't do texting. I don't do coaching over texting because I need to be able to hear someone. I am just too nervous about wires getting crossed and like not having clarity and lag time you can text me a meme, you could text me good news, you could text me something that you don't need to answer right away, but don't text me if you're in a crisis. Call me.
Interesting. I think for listeners, does DBT, is it covered just like any other, is it covered by insurance ever?
That's a complicated question. In New York City, unfortunately, and I say unfortunately even though I'm part of the system, like most providers are out of network, which is like a whole thing, and there's not enough access, especially to DBT for people of color and like just underserved populations. So, and at the same time, unfortunately, because of the way insurance works in this country and in this state, most of us are out of network. And so generally speaking, you're paying up front. If you have out of network benefits, you'll get money back. Yeah. So in terms of like the out of network coverage for it, yes, it falls into the same category as other individual therapies. Sometimes you need to write like an explanation of benefits to an insurance company because of group therapy, because you're getting 2 mental health services in the same week, which is complete bullshit. I don't know why you can't get 2 mental health services in the same week. Sometimes that's an issue, but other than that, yeah, it's completely equally covered.
Do you have any advice for someone who maybe wants to try DBT but doesn't have the access or doesn't have the financial support to maybe go to a classic DBT therapist or groups?
Or like a full adherent DBT program. So, because again, like I said, like I think DBT, I use DBT with every single one of my patients, and not every one of my patients is a DBT patient. I think if you can find, some practices do sliding scale. I know NYCBT, which is an incredible practice, does some sliding scale stuff, which is great, and I love that. So you can find a private practice that does sliding scale, or you want to find, you can find an individual practitioner who, their fee works in your range, whether there's plenty of low fee people around. And you want to like look at that person's training. If they came from a DBT center and have a strong DBT background, you'll be doing DBT stuff in sessions. So you'll get a flavor of DBT without having to do the full adherent program, and without having to spend the time and the money doing the full adherent program. So that's kind of like my best. I caution to say like read a book, because I think that oversimplifies it, and so much of DBT is relational.
Yeah.
And so that's the unfortunate piece of this. It's really hard to get the stuff without being with somebody who's a DBT person, and it is possible to find DBT people and DBT programs that are lower fee.
Maybe, do you have any advice for someone listening who has difficulty accepting their emotions? Maybe they're going through something right now.
I think there are stages to acceptance, and there are stages to pain, and I think a lot of times the things we need to accept in life tend to mirror grief, right? It's often a loss or a thing that happened that was out of your control. And so what I might say is, first and foremost, like, you don't have to like your emotions to accept them. And so as long as you're validating, which just means explaining to yourself where the emotion is coming from, you're already in better shape than somebody who's going to judge or reject how they feel. You can judge and reject all you want. It's actually not going to make you feel better. Like, believe it or not, if someone tells you to calm down, it doesn't make you calm down. So like saying you shouldn't feel a certain way doesn't help you. Saying, I wish I didn't feel this way is fine. That's okay. You can have preference. without being judgmental. And you want to be able to understand where it's coming from. And real goal of DBT is to be able to oscillate between mindfully writing out an emotion and changing or lowering an emotion when you want or need to. And so if you're going through something like a breakup or like a friend thing or like a loss of some sort, whatever it might be, you do need to spend some time actually feeling those things and like being in the emotions. And then at some point you need to ask yourself, is this working for me? Staying in this place, right? And so it's really you don't have to like it to validate it, and you have to ask yourself when you're done feeling that way.
Can you walk me through what a DBT, a normal session looks like with your patients?
Sure thing.
Because I'm thinking people are listening to this being like, sign me the fuck up. So let's get that.
I mean, like, yes, first of all, everyone could be doing DBT. So a DBT session is usually 45 or 50 minutes, individual treatment, right? And you come in, you give your diary card to your DBT therapist, which is a log that you create with your therapist at the very beginning of treatment, which logs emotions to track. So noticing intensity levels of emotions that come up daily, urges. So how badly do I want to do the thing that I may or may not do? And actions. And those urges and actions are reflective of your target behaviors or things that you're trying to work on and change. Whether it be avoiding communication, whether it be suicidal behavior, whether it be compulsive or impulsive shopping, constantly buying things on Shopbop. Not great. And Sephora now. Those are what you're tracking. And so you fill this out daily and then you bring it into treatment. I always ask my patients also to write little notes on the bottom just so I have some context. And that's what set the tone for your session. If you give this to your therapist, and it's kind of nice because you don't need to come in with if you aren't sure about what to talk about that week, you don't need to come in with something because your diary card will do it for you. Mm-hmm. Obviously you can and are welcome to bring in things you want to work on. And though, at the same time, interestingly, there is a hierarchy in DBT. So if someone comes in and really wants to talk about their ex-boyfriend, but they self-harmed that week, I'm talking about self-harm. Because the thing that we talk about first is dangerous behaviors. The next thing is what things that are getting in the way of therapy. And the next thing is quality of life interfering behaviors. But if you're self-harming or you're suicidal, then your ex-boyfriend doesn't matter as much because we need to help you stop doing the thing that's going to hurt you. Yeah. So anyway, the diary card determines the session. I'm making it sound really way mean. It's not mean. I'm kind of mean sometimes. It's not
I haven't done a diary card in 3 years.
I'm obsessed with diary cards. I love them.
Yeah, because that's what I used to do when I would go see my therapist.
Right.
Twice a week. It was always the diary card. Yeah. But now I don't know. Graduated past the point of the diary card.
Yeah. I have some people who've been doing diary cards for me for 4 years. I'm this is unnecessary, but you know what? Go off. I'm fine with this. This is great. So yeah, then it's going through the things. So if there was an urge that was acted on, or a specific high level emotions, we go through whatever is most salient on the diary card and figure it out.
That's what I love about DBT. It's what's happening in your life right now.
Yep.
Whereas before, when I did traditional talk therapy, mm-hmm. I did it for years and years and years, and I was like, wow, okay, I know cognitively why I do the things I do. I know my trauma. I know, mm-hmm. X, Y, and Z, but I know the behaviors and I know they're problematic, but I just feel I don't have the tools to change them. And I'm coming in week after week being I'm having this problem with my boyfriend at the time, and I'm really anxious and I feel he's cheating on me, whatever, but I can't leave the relationship. And then I started DBT and I'm wow, they give you the choices and the skills on a silver platter, and then it's your decision to kind of pick up what you want and to live your fucking life.
100%. Yes, that is absolutely correct. And that, the thing that I say frequently is insight only gets you so far. It's wonderful to know why things transpired the way they have. And it is regulating to know that. And it doesn't actually help you change behavior. Talking and venting does not help you change what you want to change. And so if you're committed to feeling and doing things differently, yes, there is a time and place for insight. I am not bashing insight. And at the same time, you need to know what to do and how to do it so that you can then do it. Nothing changes unless you change it.
Yeah, and what's the definition of insanity? Is like doing the same thing over and over again and expecting a different result?
Yeah, especially if you're a person that identifies with big emotions, like you feel crazy because you've been in therapy forever and yet you're still doing
you're hitting the wall.
Yep, you're still feeling the same way, you're still doing the same things, and you're like, but I'm doing everything I'm supposed to do. Like, why isn't this working? And it's not that like any particular like medium of therapy is bad, right? It's just that it might not be properly suited for you. And so you really need to understand, and like I hope that people trust in their providers to tell them when they need something else.
Mm-hmm.
You know, I think that's really, really, really important. Like a huge thing that I say to people is I'm never going to keep you in a treatment that's not working for you, because that's just unreasonable for you. It's time and it's money and it's ultimately your life. And if it's not working, also tell me. And let's see if we can problem solve it. And if not, we'll get you to where you need to go.
Thank you so much.
You're so welcome. This was amazing and you are fabulous. So thank you for having me.
Thanks for coming. Bye.